This is the second lecture of health infrastructure. In this video, we're going to explain women's health, urban, rural, and rich poor divide, global burden of disease, and Indian system of medicine. And finally, we'll explain how can we increase the effectiveness of healthcare programs in India. So let us start with women's health. Why women's health is of great concern. Women constitute about half of the total population in India. They suffer many disadvantages as compared to men in areas of education, participation in economic activities, and healthcare. The child sex ratio has been detonated from 927 in 2001 to 914 in 2011. There is growing incidence of female foeticide in the country. Close to 3 lakh girls under the age of 15 are not only married but have already born children at least once. More than 50% of married women between the age group of 15 and 49 years suffer from anemia caused by iron deficiency. It has contributed to 19% of maternal deaths. Abortions are major cause of maternal morbidity and mortality in India. A vital public good and a basic human right, all citizens can get better health facilities if public health services are decentralized. Success against diseases depends on education and efficient health infrastructure. So it is necessary to create awareness on health and provide efficient system. The role of telecom and IT in this regard is very important. Telecom department and information technology is very important. The ultimate goal should be to help people move towards a better quality of life. Urban, rural, and rich poor divide in providing healthcare facilities. It is rightly said that healthcare in India suffers from urban, rural, and rich poor divide. 70% population is living in rural areas, while 20% of the hospitals are located in rural areas. It means 80% hospitals are serving 30% population. Of 7 lakh beds, only 11% are in rural areas. There are only 0.36 hospitals for 1 lakh people in rural areas, whereas it is 3.6 hospitals per 1 lakh population in urban areas. That is, number of hospitals in urban areas is 10 times the number of hospitals in rural areas. In villages, specialized medical care is completely missing, like pediatrics, gynecology, anesthesia, and obstetrics. Public health centers or public health care located in rural areas do not have even X-ray or blood test facility. 20% of doctors passing leave the country for better prospects. Many others are interested in urban areas. Rare are the ones interested in rural areas. The poorest one-fifth spends 12% of their income on health, while rich spend only 2% of their income on health. So there is a divide between urban rural and rich people in providing or receiving the healthcare facilities. Global burden of disease. It is an indicator used by the experts to measure the number of people dying prematurely due to a particular disease. This also includes the number of years spent by them in a state of disability due to various diseases. India bears a frightening 20% of the global burden disease. More than half of the global burden of disease is accounted by communicable diseases such as diarrhea, malaria, and tuberculosis. The six systems of Indian medicine. Ayush. Ayush was founded in 2014. Number one, Ayurveda is one of the traditional system of medicine that is still used in India. It is a holistic way to achieve health through body, mind, and spirit. The Ayurvedic practitioners recommend diet and lifestyle changes along with drug therapy. They have identified a number of medical preparations and surgical procedures for curing various ailments and diseases that cannot be completely curable in other medical systems. This method of Ayurveda, such as applying herbs and massage, can also be applied along with other systems. Yoga. Yoga is as an art originated and was practiced in India from 1000 years. It has references in Upanishads and Puranas composed by Indian Aryans in the Vedic period. The main credit for systematizing yoga goes to Patanjali, who wrote Yoga Sutra 2000 years ago. Yoga Sutra is the most important basic text on yoga. It is through this means that the essential message of yoga is spread throughout the world. It is defined as an art of writers living or an integrated system for the benefit of the body, mind, and inner spirit. Siddha. Siddha comes from the word siddhi, which means an object to attain perfection or heaven. This is the oldest among the Indian medical system, namely Ayurveda and Unani. It is also known as Siddha Vaidya in India and also the oldest medical system in the world. As nowadays, people's preference to natural health remedies and herbal health remedies is increasing day by day. Siddha has emerged as an important and unique system of Indian medicine when compared to other traditional medical systems in existence. Naturopathy deals with the healing power of nature as it assumes that all healing powers are within our body. This means that within every human organism there is a healing energy. Naturopathy regards that when we go against nature, only then we fall ill. Fasting has been described as nature's way to recover. A true rest that includes fasting is the most favorable condition in which an ailing body can purify and recover itself. Unani. Unani has a long and impressive record in India. It was introduced in India around 10th century AD with the spread of Islamic civilization. Now, Unanipathy has become an important part of Indian systems of medicine. India is one of the leading countries in terms of its popularity. It is very much similar to our Ayurveda. Unani established that disease is a natural process, and that the symptoms are the reactions of the body to the disease. Sixth number, homeopathy. Homeopathy consists of two words, homeo, meaning similar, and pathos, meaning suffering or treatment. In this system, a drug and a disease that produce similar symptoms cancels each other. It is popular among the people due to its remarkable healing capacity. Also, its remedies are free from side effects. So, these are the six Indian medicine system. How can we increase effectiveness of healthcare programs? Health is a public good and a basic human right. Therefore, it should be provided to all and no person should be deprived of healthcare facilities. These facilities can be provided to all if public health services are decentralized. It implies that the power of providing these services should be delegated from the central to the local authorities. The success of healthcare depends upon education, spread of knowledge, awareness, and efficient health infrastructure. It is crucial to create awareness about health and hygiene among people. The telecom and information technology sectors can further aggravate the effectiveness of healthcare programs. Further, providing quality medical facilities at nominal cost can promote its worthiness and popularity. In order to enhance the effectiveness of healthcare programs, the main focus should be on increasing the number of hospitals, modernization of medical facilities, development of health infrastructure, improving the doctor population ratio, and increasing the number of medical colleges in India. The availability and development of medical facilities in the rural areas is still a far cry. Further, there must be some regulation to check the exorbitant fees charged by the private medical centers to make healthcare facilities accessible and affordable to all. There are some questions. Question number one: how has women's health become a matter of great concern? What is the Indian system of medicine? That's six systems. What are the principal indicators of healthcare? What is the global burden of disease? How can we increase the effectiveness of healthcare programs? What are the main characteristics of health of the people of our country? That's all from health infrastructure. Thank you.